Hey everybody, happy Saturday. I wanted to just do two today since it some days I don't get to do any. Um, the one I was going to tackle kind of briefly is essential oils, which a few people had commented that they wanted to hear about. So, this is certainly essential oils are a hot topic and many people are using them, and I am not an expert in essential oils. This is and I am going to do an educational course on this on the site um, at some point. So this is not what essential oils treat what illnesses, and do I believe that essential oils should absolutely be used or absolutely not. It's not about this. What I want to do is just give you a few warnings about essential oils, okay? The first thing is, as far as I'm concerned, I probably have a different view than others on natural remedies, or maybe a lot of people have this view. I don't know. In my mind, if it hasn't scientifically been proven to show harm in an individual, and you can use it safely, and your child doesn't have an adverse reaction to it, then I think if it doesn't hurt them, I mean, it's okay, unless there are actual warnings against the medication in question. And certainly always check with your doctor first, right? But if you think that you can use tea tree oil on nail fungus, then great, try it. That's fine. Tea tree oil topically is not bad for you. It smells really good, so that's fine. Where we get into issues is when these remedies are used incorrectly or inappropriately, right? So peppermint or some forms of peppermint can be toxic, and oil of wintergreen. So if grandpa has it and he rubs it on his muscles because his muscles are sore, and then the toddler comes over and finds the bottle because grandpa forgot to put the top on before he walked away, and it gets ingested orally, that's a toxic dose of salicylate or aspirin, okay? So even a little bit of oil of wintergreen is a huge amount of aspirin, which is dangerous. So again, something that's topical, when used appropriately and sparingly is fine, but when used the wrong way could be lethal. So that's what I want to express is, I'm not saying they're perfect or they're terrible. I just want y'all to be safe if you're using them. Nutmeg, if used, if misused or abused, can cause hallucinations and coma. Eucalyptus, I love the smell of eucalyptus. Wow, that smells so good. Aromatic, your eucalyptus oil in your diffuser is great until somebody, a kid finds, ooh, what's this? It smells good. I'm going to drink it. And then eucalyptus can cause seizures. So again, being very careful with how you use it, the storage, etc. Sage oil is another one that smells really nice, but if ingested could cause seizures. Camphor could be toxic in two different ways. It can be toxic if ingested by mouth, and if used in copious quantities on the skin, especially in open skin, like open wounds, right? But even without open wounds, and I'm talking about like a lot of consistent Camphor application, it can get absorbed systemically, so just absorb through your skin and then be toxic. Okay, so like I'll recommend Sarna is an anti-itch lotion. It's camphor, it's topical camphor. I only recommend that for kids with eczema. If I'm confident that I can get across to the family to just do a little bit, just a thin layer once, maybe twice a day, a really thin layer, and then it goes up in the cabinet, like way up high. The kid can't get to it. Okay. Because that's something that's not without risk if they really get into it. We talked about infusers, or the things that smell really nice. Just remember, if you're using those, especially like if you have a business and you're using it at your business, that can be a pulmonary irritant to an asthmatic, right? So that can trigger an asthmatic to wheeze and really have a hard time. So smells great, gets you calm, relaxed. But if, like, we would never do it in the ER because it may trigger an asthmatic or respiratory kid to have increased work of breathing, and we certainly don't want that. If there's so many more things we could talk about when it comes to essential oils. I think there are medications that are over the counter. In my cold medicine talk, I touched on Zarbee's, and Zarbee's is honey, but it has grapefruit leaf extract, I think is what it is. I don't know what that does. I don't know what grapefruit leaf extract does. I'm sure they wouldn't market it and package it and sell it if it wasn't safe, but I don't know what that does. And so I'm going to be hesitant to give that to my child. Any of those organic or natural medications, and I'll do that in another talk. I just don't know what all of those ingredients are, and what are their effects, especially if you look at those medications. A lot of those come in combination with multiple different types of herbs in the same medication, and so that's a concern of mine as well. So kind of on the topic of essential oils, I guess it could be oil, it could be essential oils, or like oils that you put into a lamp, like a hurricane lamp, but you may have one of those candles that you put the nice smelling oil and then you put the candle. And so those are highly volatile. So if a kid drinks it, they will aspirate it. So it will go into their lungs, and can cause a significant pneumonitis. So in my chest pain talk, we talked about itis. Itis is inflammation, or could be infection, but it's inflammation. And so it causes significant inflammation of the lungs. And so again, you just want to be careful with how it's supposed to be used, how it's stored, all of those things. So just like I tell anybody else, if you think it helps them, whatever the therapy is, like I give, I hope my mom doesn't get on me for this, but my mom, when the boys were little, swore, I think she still may, swore that rubbing Vicks on the bottom of their feet and then putting socks on, that's what makes their cold get better. I don't think there's any scientific evidence to that, but if it makes her feel better and it doesn't hurt them, then That's okay. So if you think it is helping your child and you've gone over it with your primary care provider and you know it to be safe in the way you're using it, then go for it, you know? But I would just make sure you're being as safe as possible when using these substances, because they're not all they may be all natural, but they're not all benign, with zero risk. And so make sure you have the number to your poison center, right? Poison control, available at all times. I actually, on the website, I put a link to the Poison Center website at the bottom of my website, but it's poison.org. And the Poison Center, no matter where you are, is 1-800-222-1222. And you can even do it on your computer. There's a Help Me online. Your poison, typically your phone rings the Poison Center of your area code. So my phone is 901. So when I call poison control, it's going to ring the Tennessee Poison Center. Someone with a Louisiana cell phone, it's going to ring the Louisiana Poison Center. If they tell you to go to the ER, go to the ER. Okay. Just please take them seriously in whatever advice they recommend. We actually don't recommend inducing vomiting. So that's an old recommendation that is not recommended anymore. So if you have a doubt at all, just call the Poison Center. Okay, I hope that was helpful, and maybe one day I really like toxicology, so maybe one day I'll put this and some other things into a kind of a toxicology talk. But I hope y'all have a great rest of your day. Let me know if this was helpful, and if anybody's done any of the courses, I would love some feedback. Thanks. Have a good day.